Rabies is a viral disease that affects the central nervous system of mammals, including humans. It is caused by the rabies virus, which is part of the lysovirus genus. Rabies is typically transmitted through the saliva of an infected animal via bites, scratches, or open wounds. The most common vectors are domestic dogs, but other animals such as bats, raccoons, skunks, and foxes can also carry and transmit the virus. Once the virus enters the body, it initially replicates in the muscle tissue near the site of entry. The virus then travels along peripheral nerves to the central nervous system using retrograde axonal transport. Within the CNS, the virus rapidly replicates and causes encephalitis, an inflammation of the brain. The virus also spreads to other organs, particularly the salivary glands, which facilitates further transmission through saliva. The incubation period of rabies can vary significantly, typically ranging from 1 to 3 months, but can extend from a few days to several years. The length of this period depends on factors such as the location of the bite, the severity of the wound, and the amount of virus introduced. Rabies progresses through several stages. Prodromal stage lasts 2 to 10 days. Early symptoms are nonspecific and may include fever, headache, malaise, and discomfort or paresthesia at the site of exposure. Acute neurologic stage. Infurious rabies symptoms may include hyperactivity, excitable behavior, hydrophobia, and aerophobia. Patients may also exhibit agitation, confusion, and hallucinations. Paralytic rabies, gradual paralysis starting at the site of the bite or scratch. This form progresses more slowly, infurious rabies, but ultimately leads to coma and death. Without treatment, rabies invariably leads to coma and death, typically within days of the onset of severe symptoms. Diagnosis is primarily clinical, especially in areas where the disease is common. Laboratory tests, such as direct fluorescent antibody testing, polymerase chain reaction (PCR), and virus isolation, can confirm the diagnosis. Once clinical symptoms appear, rabies is almost invariably fatal. Therefore, treatment focuses on post-exposure prophylaxis (PEP), which involves immediate and thorough washing of the wound with soap and water. Rabies immunoglobulin (RIG), administered to provide immediate passive immunity. A series of rabies vaccinations to induce active immunity. Preventive measures include vaccination of pets, wildlife control, human vaccination. Rabies is found on all continents except Antarctica. It is more prevalent in Asia and Africa, where dog bites are the main source of infection.